Are you guys on?
We're all,
Oh, okay. We're ready to start?
Yes.
Call the meeting to an order. We have a quorum. Yes. We stand and say the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Connie, will lead us in prayer?
Our Father in heaven, as we gather this day, we ask that our hearts and minds might be open to thy will, that we might be able to gain greater understanding for all those who are involved, that this institution, that this organization may move forward through progress. For this blessing we ask in the name of Jesus Christ. Amen.
Amen.
Okay, we have H&H Leadership Solutions here to present. And if you gentlemen would like to go around and introduce yourselves, and we can get started.
Absolutely. So I'll go ahead and lead off. My name is Stephen Hartz. I'm one of the principals and presidents for H&H Leadership Solutions. My background, I'm a retired naval helicopter pilot. I spent 21 years in active duty service. During that time, I did 10 operational combat deployments and then transitioned over to the Pentagon and worked on policy, working with the Senate and Armed Services committees there, which was an interesting evolution. I transitioned into what we do today, which is working on healthcare solutions for organizations. We work coast to coast, north to south, east to west, and work on small organizations, critical access and rural hospitals, to large organizations like Johns Hopkins and UVA and some of those facilities. I'll pass it over to Charles.
Well, good evening. My name is Charles Hall. I'm also H&H Principal, the president of H&H Healthcare Solutions. Background, similar. I'm a clinician. I wear the hat of a medic, a critical care nurse, and throughout the years I've worked through the ranks in either developing programs, clinics, emergency departments, specialty, but also a brief stint as a chief nursing officer and a CEO of multiple hospitals throughout the last several years. When we kind of reflected, Steve and I, in building this organization, one of the whys is we wanted to be in the rural setting in many of our impacts, and that is helping organizations just like you be patient-centered. And not from a distance, but shoulder to shoulder as a coach moves forward. And so as we're spending a little bit of time, I thank you for the opportunity that we had here today.
I'm Thomas Steiner. If you may have picked up on it, I'm from New York City. My background is I was in homeless, working in a homeless population in an urban setting. Went real interested in healthcare during that period of time. My clientele were those who were diagnosed with a serious mental illness, chemical addiction, or HIV positive, or some combination of the three. From that, at the ripe old age of 35, I got interested in healthcare and went to graduate school. And from that, I had the privilege to go down to Mobile, Alabama, which is another urban setting, recruited up to Delaware in a rural setting, to Georgia in a rural setting, Mississippi, rural setting, back to Georgia in a rural setting. I get kicked out of a lot of states, okay? Ended up in Alaska. So I have been with FQHCs, rural healthcare clinics, been in critical access, rural hospitals, medium-sized hospitals of about 250. I'm thrilled to be here. I've spent some time with your team. Real excited to share with you. I know I've talked with all of y'all, and come my portion, y'all can applaud, okay?
I love it. Hi, everybody. My name's Aubrey. I'm with H&H Leadership Solutions. I am VP of Marketing and Community Engagement. I came about this journey in a roundabout way. I spent 20 years in nursing, also started as a Navy nurse, and then did all sorts of nursing roles from leadership to clinician to a manager, and then I spent some time in quality also. So I've done it all, and then I came back to my love for marketing and communication and decided to combine both of those skills and do marketing for healthcare organizations. And what I love about working in smaller critical access rural hospitals is being that extension to the marketing team. Often the PR person, the marketer, is wearing so many different hats that social media falls off the wagon. And in this day and age, when people can research and look up hospitals and doctors and make their healthcare decisions, being on social media is really important. And I love to be able to help organizations do that. So I think that's it. But I think I'm next. So.
And I apologize.
Yes.
I didn't know who you were. I mean,
Oh, that's
I
okay.
heard your name, but I didn't know that.
That's
so
okay. There you
apologies.
go. Nice to meet you guys all. So I'll just go into my section. But as a marketer, for hospitals, my aim is to really create, curate, and deliver messaging that emphasizes the mission, vision, and values of the organization, and have that messaging resonate as well as the community. As a nurse in marketing, I think it's really an opportunity to provide patient education. It's a way to distribute nuggets of information to people who are on social media but maybe hesitant to come to the hospital, or who don't need to come into the hospital for any acute situations but can receive dietary information, health and wellness, preventative care, injury prevention, any little tidbits of information we can deliver. The way people receive knowledge, which online and in social media is in 30-second chunks, minute chunks of time. And that's how people these days want to consume education. And so it's a real opportunity to connect with people at home, on the screens where they're spending a lot of their time. Additionally, I think one of my roles is to help with building the culture of the organization, again with that messaging, but from a recruitment standpoint, social media can also help in conveying the great work culture that's within the organization by highlighting its people, highlighting the culture, highlighting the great works, showcasing testimonials, and sharing that appreciation. So I think there's a lot of reasons why social media can become a really important asset to a healthcare organization, and that's really my hope here. I think we're in a unique position to raise awareness, combat misinformation, which I didn't touch on. During COVID, when the information was changing constantly and no one knew what was the real source of truth, we want to be that source of truth for this community, and that's essentially what I want to do. Communicate during crises, expand the reach of recruitment efforts, common questions, and then promoting citizen engagement. So I know you guys are involved in a lot of events in the community, so getting people to show up and come, like this Saturday, the wellness event, there's screening, so any touch point, we want to help highlight and bring people together for that. I think I have one more quick slide. So I think I covered all of this, all the opportunities that we have here, and I had a great 2 days already doing a lot of this work. So highlighting providers, employees, services, things that you guys have already had. I got to visit down at the skills fair and film some great videos already. So I think I have 2 examples, one that I filmed today with Patrick Gleason, and then one that I filmed at a different hospital that I would really love to do here that I think highlights the organization really well.
Yeah, quick question. How we generally work is we feed off of each other to bring out the best part of our time together. So Aubrey, thinking a little bit about your research coming here,
Yeah.
Getting together with Denise and the team, where they've been and a vision on where they can go. What do you see?
Oh, yeah, I see the social media being a community resource for the page. I think ultimately it's the sounding board for physicians, providers, to interact with the community. I see it being a place where everyone here can go and meet the providers, they can meet people they might be working with, and interact. I think it's a place where we can really promote your providers and the type of excellent care you guys are giving here through a variety of videos and formats. My hope is that we're going to be on all the platforms. LinkedIn from a professional standpoint, so we can recruit better, bring talent here. Instagram, so we're reaching that younger demographic where they're hanging out and producing the kind of content that they're going to love to engage with and participate in. Facebook, still, because it's the biggest and most used platform, so we need to be there. And then, of course, the website, looking at the website, making sure it stays up to date and modern, and provides all the information that people are going to need. We want everyone to have a great user experience, and I think a lot of that begins online nowadays. If you're a new patient in the community, you're going to do that research, and oftentimes the digital footprint is where it begins. So, and I want everyone to have that great first impression when they look up Weston County Health Services. So, I've got some videos to share.
There you go.
Let's see which one comes up first. This was an employee testimonial video, and I see a lot. I just want to preface this, but
I come to work every day
go ahead.
being happy and excited to serve our community in a way that impacts their health and their overall well-being.
Working at Cascade Medical Center kind of feels like working with a big family.
I've lived here my whole life, and I just think we have a great community who supports each other.
And so many of those people in the community that were like parents to me are now people that I'm serving within the community. It's people that have really touched my life and my family's life and are important. Clearly, I mean, it means a lot to me.
Pues me siento muy contenta con mi trabajo que hago, de cómo veo mis compañeros, su reacción hacia a nosotros los housekeeping.
Not only within my own department, but I can walk down the hallway and I'll know who works in a different department. So I love how everyone here is very connected.
Patients that I see on a monthly basis, I've been seeing for the past 10 years. And they know things about my personal life, I know things about their personal life. And it kind of just feels like a really big extended family.
It's that small community care that I think is so important, where you feel like you matter and you're important. All my kids came here from birth up until they're older now. My youngest just graduated, and they all came here for care and continue to come here for care.
So, listening to these guys talk, when I was doing my tour at this hospital, I got so many of the same feelings here from everybody I talked to, and I think I really want to share that. That's, again, part of why I like working with small hospitals, because of all of these sentiments, and I think that's really impactful to share. So I think we can create those kind of videos here in time. And then I've got an educational video I did with Patrick today, and I want to emphasize it doesn't have to be over
Work every day.
or stressed out. He did it on a whim, no practice, no rehearsal, and super authentic, and I think that's really powerful online these days.
Hello, I'm Patrick Gleason. I'm a nurse practitioner. I think what you'll like here about getting care at Weston County Health Services is that we provide very personal care, where you sometimes get busy, but for the most part, you'll get right in and be seen pretty promptly. Also, you're going to be seen as an individual, not just as a number. And so we take our duty to the community very seriously, and we will actually hopefully be able to sit down with you and talk about not only what we'd like to do, but your needs as well. We do a lot of shared decision making here at this hospital, which means you get to participate in your care. We're not just going to dictate to you what you have to have or what you can't have. So I believe that providing that personal level of care will help both of our experiences, not only as a patient but as a provider too. It's very rewarding to be able to actually take care of our community, provide good care.
So I'm excited about making more of that content. I should be here every other month or so to schedule an entire day of shooting, and I can't make content unless I've got volunteers, so I look forward to your participation in the future. Yes?
So yesterday you did some posting.
Oh, I did. We made a quick little video of the Employee Appreciation Day. And it's gotten thousands of views already of just Michaela in the kitchen making nachos. You know, and a lot of great feedback. Yeah, and it's just fun to show behind the scenes. People want to see what we're up to, what we're doing. I think it's great stuff. It's great content.
Made me hungry for nachos.
Right?
What I would add is, you know, when you have also others in the community that may not have the best impression, or they may be putting out other messages, you want to lead and drive your message as an organization. What are the great things that you're doing? There's always able to find something negative, and we know this, that, right? One negative thing happens, it ruins 99 great things. But the more we get the positive message out there, the more that the community understands that you're not just an aid station, you are the hospital, you are the quality choice of care here in the community. You're going to get more participation, you're going to get better results, better responses.
You know, when we think about what the modern day hospital is, a long time ago it used to be a place for healing and coming off of injury or illness. Today it's a community center. It's a place to receive knowledge. It's to tell a story, a patient story, to articulate the care that goes on here. It is a forward-looking interaction of caring for a community. This platform that Aubrey brings and the work that you have already done really is a key driver to telling our story. So we earn the confidence of our community and our patient every time. If we're not telling the story, somebody else is. And so this is a key initiative of just getting out what we do and what we offer.
Any questions? All right. So when we talk about our agenda and what we're doing, what we've done over the last couple of days, and the potential for the future, one thing I want you to take away from this is the need for data, information, verifiable information, objective information. Where do we get some of that information that we used over the last 2 days? We had a copy of the Board of Trust bylaws, the employee handbook, your policies, of which you have a little over 1,200, which is quite exciting reading. And then we interviewed about 30 individuals within the organization. That included everybody from trustees, physicians, staff, support staff, etc. Everyone provided pieces of information into the puzzle that is your organization, and try to get a good understanding of where you're at and try to learn about your team, your culture, some of the successes, some of your challenges. This is an eye chart. You didn't know you were getting an eye exam today, but this is an overview of what our agenda was for the last 2 days. Thomas, Charles, and I met with the majority of the staff over the last 2 days to be able to present to you. So we're going to take a second and we want to talk about board responsibilities, because the foundation of any great organization and hospital is their boards, right? You set the tone for everything. When we talk about board responsibilities, there are 3 key things that we always remind every board, and we do it before every board meeting, right? We have the duty of care, the duty of loyalty, and the duty of obedience. Those 3 things are universal in any nonprofit board that you go to in the United States, all right? Now, with those things, what does that mean? It means that everything is about the organization. If you're on the board, you're part of the board, every focus has to be about the organization. There's no personal agendas for you, yourself, your business, your organization, your family, etc. Typically, as we go through this, there are laws that kind of govern this. And the things that I like to point out is that you as a board member can individually be held responsible. It doesn't matter whether you're paid or not. You got elected to this position, you personally can be held responsible for the duties that you're supposed to be carrying out. Okay? We tell that because I don't think that the community always necessarily understands that being on a board isn't like being on a soccer board. Being on an elected board, you have responsibilities that go far beyond just making decisions or, you know, enjoying a cup of coffee with your closest 7 friends, you know, once a month, right? The reality is you are making decisions and you guys are willing to take on that responsibility for the community. That's a big responsibility. So this picture, I think this picture says 1,000 words, and I would love to say it would just be your organization, but the truth is it's just about any organization in healthcare. There's what we see, which is this top 1/3 of the organization, right? And then you don't see all the stuff underneath the water. When we look at the clinic as our scope of our work, which we'll get into in a second, we were really looking on that one little section of your organization. But typically, that's systemic of what's going on throughout the organization as a whole. Okay? And I want to stress again, you are not unique. You know, you're not unique in the challenges you face. You're not unique in some of the struggles you were having. We have been in multiple critical access hospitals across the nation, north to south, east to west, and most of them are facing an aspect or all of the aspects that your organizations are challenged with. They also don't have some of the beauties and greatness that your organization has, like your amazing staff or your amazing facilities, right? Your patients. So you got to take the good with the bad with what you have and understand when we present to you the information, realize if you feel that you're unique, it's okay. This is one of those times you don't have to be unique. You're not. And if you have questions, please do not hesitate to reach out and talk to us here today. Or if you have questions for us later, we will share our contact information. You can reach out to us at any time. Okay? Charles?
So a couple of weeks ago, actually Thomas and I were introduced to Randy, and we started to kind of learn about your organization, what the challenges were. We requested a few documents. We started having pre-visit interviews, getting to know people, to feel the pulse of the organization. And yeah, you're right, there are some challenges here. And the first step that we said is, let's listen to the team. Let's get out there and listen to the clinic team, the hospital team, the providers, and really understand really what those core concerns are. And so we did that, and we focused on communication, leadership and management, the dynamics, the work environment. And today, as we move forward, we're working not to identify a who. It isn't about the who. Who said what to who? It is about where we are today. There's a billion stories out there on how we got there. No, let's talk about we are here and how to move forward. If we get stuck in the past, we're not going to go forward. So as Thomas and the team begin to work through this assessment with you, please know we work on themes, and it really isn't about the who, it's the what, and then how we move forward. So this is what this piece of the assessment looks like. Thomas?
Thank you, sir. Next slide, please. As Charles and Steve and Aubrey have said, my name is Thomas. You've heard from me. I've spoken with each of them here by and large. So you know a little bit of what I'm going to say, because I promised you there was nothing I'm going to say that's going to shock you. It's going to be an affirmation. There was nothing that we heard that shocked us. Now, there was plenty that made us say it. Don't get that wrong. But there was nothing that shocked us that says, oh my goodness, we've never seen this before. I've earned every one of these gray hairs. I think Randy has earned
I'm trying to see the bridge here. How's this going to work?
So as we tee it up, let's set some ground rules, right? So if I say something in here that can be taken in more than one way, and one of those ways is mean or hurtful, I meant it the other way, okay? This is a dialogue with our Board of Trustees. This is a participatory opportunity. And if you say something that can be taken more than one way, and one of those ways is mean, I'm going to refer to Rule 1, okay? So those are sort of the ground rules for this. I do want to say, on behalf of this entire team, thank you for the privilege and the opportunity to be here. You have an amazing potential. This is an honestly gorgeous place. The people here who are working in it want it to do well. In my background, I'm one of the experts in customer service. We use Press Ganey. We were in the 97th percentile. I was director of customer service. Clint Studert, who is sort of the guru of all of this, will tell you, if someone is complaining, they are telling you how to succeed. The moment somebody shuts up and doesn't complain, you've lost them. So every complaint is an opportunity for us to listen and to say and set expectations that are realistic. We've heard some things that were heartbreaking, not shocking, and heartbreaking in that some of it's needless. Some of it's just human action. Some of it's needless. So this is where we are on March 5th, 2024. I can't say where we were on March 3rd. I can't say where we were on January, and I can't tell you where we're going to be in April. That is for this table to decide. That is for this table to decide. Next slide, please. Oh, I'm sorry, here we are, great. There's going to be a test on this. I'll keep nattering. For the 7 colleagues here on the Board of Trustees, I'm going to ask you the question, why are we here? Why is there a Weston County Health Services? And you don't have to sweat. I'm not taking notes on this. I've done that with all these colleagues around this table.
Denise is.
Okay, Denise is. So, why does Weston County Health Services exist?
For our people, for patient care, for excellence.
Thank you.
Well, it's the backbone of this community. I mean, without us here, I don't know that anything else would survive. So we're very, 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 have to be very cautious about what we do and how we do so that we can stay here, keep 220 jobs or how many ever we need, so that this community can thrive.
Sorry, it's taken me a moment or two. I was trying to think, I've been to some communities that didn't have healthcare. And they didn't have access, and I witnessed what it was doing to their community. And I certainly think that we need it. We live far away from cities. And so we need to have a place that we can have preventative health as well as health for those end of life health. So we really need for this community the span of all.
Coach. And improve the health of the community, it says it right here. And I agree with that in more than one way, physical, mental, and that's what we're here for, is to provide, make sure that the community has healthcare, and just make sure that we're improving with that, and then being aware and educated on everything. And I've taken it for granted that I've always had healthcare. I've never lived where you don't have healthcare. So when you're saying that, it made it kind of clear to me, is like, it's definitely a necessity that we have this. So I don't ever want to live in a town that doesn't. So how do we sustain that?
Thank you.
Plain and simply to serve the healthcare needs of the community.
Absolutely, thank you.
I'm on with sometimes I feel like we need to be a help to our people. We need the best way to keep them preventative or when it's actually happening and be a help.
Thank you. Donnie, you out there in cyberspace? You're on mute?
She's probably on mute.
But she's saying great things. That's all.
I finally got off.
Okay.
My thought of it about this is that we need to give the best care, the best customer service, the best teaching opportunities, the best support that we can give this community, because we owe it to the community to be there for them in their time of need and their time of happiness and their time of whenever they need something along the healthcare field. We need to be there.
Thank you. And every one of you are accurate and correct. I applaud and say you're absolutely right. Absolutely right. So as we transition into the assessment, some of this is pretty heavy. And you'll see in black and white. And as I promise you, there's nothing that you don't already know. You live here. You're dealing with this day in and day out. And as Steve said, this is the 1/3 that we're seeing right now. This is the tip of an iceberg, perhaps. As we go through this is time for you to stop and say, hey, Thomas, will you please expand on that, see if this makes sense. If it doesn't, we can explore it a little further. Next slide, please. So, many of y'all have heard this fable before. For those of y'all who have not, this is attributed to a Chinese fable. And there was a farmer and his son, and they had a horse to help out on the farm. One day, the horse broke free and took off, and the farmer's neighbors said to the farmer, what bad luck, your horse has run away. And the farmer said, maybe yes, maybe no. A little while later, the son looks up, and here comes the horse, and trotting behind it are 2 other horses. The son opens up the corral, the horses trot on in. The neighbors come to the farmer and say, Farmer, what great luck, you got your horse back plus 2 horses. What great luck. Maybe yes, maybe no. The next day, the son is out in the corral working with some of the new horses and gets thrown and breaks her arm. Sorry about that, I just couldn't remember that. The neighbors, seeing the son in the sling, come to the farmer and say, what bad luck, your son has broken his arm. Maybe yes, maybe no. The next day, the army comes through conscripting every able-bodied male to go off to battle. They see the son, the broken arm, they leave him alone, and they go on. The neighbors come and say, well, good luck, your son has not been conscripted. Maybe yes, maybe no. Well, the moral is every decision that we make has consequences. Are they good decisions? Bad decisions? Maybe yes, maybe no. Next slide. So is this a good overview of what the Board of Trustees feels about the culture on March 3rd, 2024? Maybe yes, maybe no. Board of Trustees themes, there is a real or imagined, the staff continue to have concerns over retaliation. Is this sort of resonating, board? There's a lack of trust in leadership. There is a lack of respect for each other. There is a culture of favoritism that is deeply ingrained throughout the decades. There is no trained in-house leadership. As a team, and I found this comment to be very self-aware. As a team, the Board of Trustees is not an effective leader. They're smart people, a ton of potential, but we are too polarizing and demonstrate little respect to each other. If the Board of Trustees demonstrates this behavior, we should not be shocked that the staff will do it as well. There needs to be a new culture. Our leaders have changed, but our culture has not. Over the decades, we've had Garcia, Maureen, Judd, Piper, Randy, 5 CEOs over 30 years. The leaders have changed, but the culture has not. The one common denominator is this table. To a person, good doctors, good care being provided, safe care being provided. Board of Trustees, this is your meeting. You don't have to listen to anyone out there. This is your meeting. course, you can do that anyway. Does this resonate? Not pretty, is heavy. Recognize that you're not alone in your journey. Others are like this, but this is your journey and your first time in it. Does anyone disagree with anything that we have up there?
Nope.
Okay?
No.
Nobody's talking, but no, these
You know,
are
hey,
the things that
if
we
no one-
talked among ourselves as well as, expressing to you.
If no one says anything, in the absence of information, I'm making up my own mind, right? Next slide, please. Our physicians MPPA themes. We are creating inefficient workarounds instead of dealing with personalities. There appears to be low trust. There seems to be more satisfaction in pointing out errors than discussing face-to-face ways to improve. Employee doubt and fear. There appears to be an element of a toxic work environment. Inconsistent meeting participation that helps build up medical staff rapport. They're good doctors. 100%. They're good doctors. Professionalism and credibility is harmed when public comments are disrespectful. There is an appearance of favoritism, and of course, being good clinicians, they made the diagnosis and now they gave us a prescription, right? Put an end to disrespectful communication, adhere to a fair process to report problems in a timely resolution. Does that seem unreasonable? Is anything up there that's shocking to you? Next slide, please. Our clinic staff themes. There's a fear of retaliation. There appears to be a toxic culture. The HR policies are inconsistently applied. There's a disintegration of trust and leadership. There's no consistency, no accountability, no integrity. We watch those with higher education and those who are on the board act unprofessionally and immaturely. I think that's pretty self-aware. It's painful to hear, but the articulation is pretty damn strong. Why can't we just come to work, do our job, be respectful, and leave the drama at home? 100%. The care is good. The care is safe. 100%. Next. So our Venn diagram, where there's some overlap from every one of the groups that we talked with, is there's inconsistent leadership, there's low trust, low respect, fear of retaliation, toxic culture. The care is good, the care is safe. It is not all bad. Do not hear that. And in customer service, if the complaint is made, they're telling you how to succeed. They are still engaged. The moment they shut down and shut up, you've lost them. Y'all need to take a breath, stand up.
We're used to long meetings.
I'm sorry?
I said, we're used to long meetings.
Okay, so be bright, be brief, be gone. Next slide. So I got to thinking about it, and Dr. Smith, he spells his name differently than we do in Alabama. Dr. Smith was talking about anger. And if I can, anger stems from unmet needs, perceived or actual wrongs, loss of control, threats, and barriers to our chosen direction, whether it's a traffic jam or more abstract blockages, such as bureaucratic red tape, can all activate seeds of it, our anger, that are discarded below the surface. I might posit to you that what you heard from the clinic was anger because of unmet needs, perceived or actual wrong, loss of control, threats, barriers to our chosen profession. But that is a symptom of what something else is. So, we good? Next slide, please. So it's simple, it's not easy. Where we are today is a logical consequence. Here's that word, maybe yes, maybe no, it's a consequence of decisions made or those not made at this table over the decades. Not you, I'm not pointing fingers at anyone at this table. Recognize that the organization Board of Trustees has to absolutely have a longitudinal run, and it is not about any one individual in this organization. It is never about the person. It is about the position we hold to make sure that there's great succession planning and that the plans that we make and strategy continue on. And I would say it's easy, simple, I'm sorry, it ain't easy. So we are here today because of the decisions made at this table. It's logical. This isn't magic. Will the consequences for this assessment be good or bad? Maybe yes, maybe no. And here's, full pen counts of 3 law grenade. This governing board has irrefutable comments of what the culture is at the tip of an iceberg. It is up to this board to decide what you're going to do. If you like where we are, shake our hands and send us out. If you say this is not a good place for us, then this table needs to make a decision and say what it's going to look like and move forward. Agree? Next slide. All right, I'm going to take a deep breath here. Does anyone know Cleveland Clinic? Raise your hand. Cleveland Clinic is probably one of the premier academic teaching hospitals in the world, you could argue. And at one point in time, they had an interesting challenge. Was I'm Cleveland Clinic, of course they're going to come to me. I'm Cleveland Clinic. In the southern vernacular, they got too big. They thought that they were better than they were. And the leadership there, wise leaders, smart people with a ton of potential, sat down and said, we have a culture problem. Why are we here? 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 And from that, they said, we will do something different. I want to warn you, you will recognize in this video many people who are experiencing things that you are experiencing or have experienced. And that can be a little humbling and a little vulnerable. Cleveland Clinic, the premier place, put this together for this reason, to say, why are we here? And they blasted it to their staff, they blasted it to their patients, and then they blasted it to the world. So, tissues are right there. I don't mean to frighten anyone, but when you see this video, it has resonated with parts of our journey together in healthcare and as healthcare providers and as healthcare recipients. So 4 minutes and 30 seconds of video.
It was interesting when he was removed. There's quite a few people that will remember my comments at the time because it came after Ogden reportedly, I guess you should say, because it was reported and then they claimed that he claimed that didn't happen, but we all saw the letters where he made the chairmans of the board sign that we're going to do this and that and the other thing, and we're not going to disobey. And
we're not going to disobey. I love that. I love that part. We're not going to disobey.
Pretty much. That's what I got
Yeah.
from it. Reading it is, aye, Captain, we will follow your rule. It kind of made me look a little different at Driscoll. And then this year's made
Well,
it
and you
even.
didn't just look different. Come on. You gave him a nickname even.
I gave him a nickname. He was saved in my phone still to this day as Dictator Driscoll. And I still don't feel bad about that because Weston County hasn't seen him once leading up to this session.
So the questions asked during our time here, based on what we heard, was, Thomas, how do you rebuild trust? How do you build respect? How do you remove a toxic work environment? How do you remove fear of retaliation? I might reframe those questions. Is the Board of Trustees willing to harness its energy to create a solid structure that supports world-class empathy for the community we serve? And is the Board of Trustees willing to take ownership of a culture where our team knows why they're here? And that's your question. Was the assessment good? Was it bad? Maybe yes, maybe no. I want to honor those people who are out there right now, giving their all for that team in their community and their patience. You owe it to deliberate those questions hard.
Thoughts?
My thought is we need more education as a board. We've never had a board. I mean, we've had a little bit of training, but not much, no. And I think people, we need to really hone in on what we, as board members, what our responsibilities are.
Any others?
I think that to that depth, I don't think it's ever been the board's responsibility to that depth that in the, in the past.
So let's do a call to action. The why. As a board, I've managed and been on boards and worked with boards closely. Boards are complex. Let's be honest, a board is a group of volunteers with varying backgrounds. A difference between a board that happens to come together and a proactive governing board is very intentional. We look in the mirror and we go, how can we complement our team? Who has this skill set and that skill set? And how do we assure that there's a clinician on the board to really help us translate as a board what we're looking at? It requires financial acumen and maybe some business understanding, or a piece of the rev cycle, or the people pillar, how to care for people in a customer-friendly kind of way. The board has a responsibility of, I'm a clinician, I'm a nurse, I'll say it every day, a pulse of the organization. How well are they doing? Fiscally, how good is their quality care? What about patient customer service like HCAPS, patient experience? Does that information get to the center of the table, and is that what you're looking at to help guide this organization to a better tomorrow? Healthcare is unbelievably complex, and the complexity today is very different than the more complexity it is tomorrow. I think it starts out with today, just looking at us and saying, what do we need to be properly equipped to guide this organization forward. What is the vision of this place? How does that lead to a strategic plan? And then how do we work and provide the resources to the team to hit milestone after milestone, proactively caring for your community? This is a community center that provides care, education, and knowledge for its community. Proactive care, population health. It is transforming away from the acute side of medicine to more of proactive care of the body to prevent chronic conditions. That is a piece of healthcare's mission. So who we are today, my question to you is, do we want to be that same person tomorrow? And as we start walking through the recommendations, it is asking a lot of questions, doing your due diligence, learning the journey that we have. And so I would say who we are today doesn't have to be who we are tomorrow. We have a mission, the patient. True? I want to do something. They don't know me that well, but I'm getting into their bubble, and I created a couple smiles here. How's it going? She's like, what? Right? And they need your support. The people who provide the care need that high-level direction and the resources needed to be able to do their job. And so in this case, it starts out with us. So a couple calls to action. It's about the patient. And for those clinicians out there, it's about doing no harm. That is our mission. Quality, safe patient care by doing no harm. I would ask you, in the small time that I've been with you over the last few weeks, kind of in the shadows, has the majority of our energy been toward what? The patient or this other stuff over here?
Putting out fires.
That's right. From the reactive, our goal is to get proactive and to get this organization back on track. Does that make sense? All right. Great dialogue here. We came in to this, the team, about 2 weeks ago, starting to interview the team members over the last couple of weeks, requesting documents, putting the puzzle pieces together. You saw that iceberg. Our time here generally is a little bit longer. At the prep time is a lot more documentation, a lot more interviews before we get here. We're usually here for 4 or 5 days. We can really get ingrained, put our fingerprints on a lot of things. Symbolic, we look in drawers, not really. In cabinets, open doors, under rugs. It's not designed to gotcha. It's really to understand the core of the organization. Here, it was just a high-level scratch. Next slide. So we really like to come in for an operational assessment. This was uncomfortable today, is that true? The conversations that we've had, the stuff on the screen from Thomas. An operational assessment is a deep dive into the core of all of your programs. From the quality program, don't be too nervous over here. You're good. To the finance program, I know you have a specialist working on that as well. To your compliance program, regulatory, the things that open up our doors to allow us to actually provide that care. An operational assessment, a regulatory assessment, and regulatory consists of 4 programs: compliance, risk, privacy, and security. They are things that the H&H talks about. It's the federal government that enforces on that part. There is a large gap in knowledge and activity in how we manage our organization. I would say risk to the organization is one of the biggest risks right here. Making sure we're in compliance. Now I can tell you, we didn't go deep into it like, hey, there's something that we're not doing right. We didn't go that. We looked at certain things, talked to certain people, and we said, oh, this needs to be focused on and built. I know we have some turnover in HR. HR is the people pillar. The people pillar are the most important part of this organization. They deliver care. And right now, as we scratch the surface and look at the HR department, the knowledge, the skill set, yeah, probably need to know what good looks like. Bring in an expert for at least 90 days, do the assessment, understand what's going on, have that individual come back to the table here and give you those findings. From a board duty side, you would say things like, great, what does that mean? And two, when can you get it fixed? And then monitor that activity to make sure we're moving in the right direction. So an operational assessment, a regulatory assessment, and then bringing in a chief human resource officer to get us on track on the people side. Now, many times we think about HR as, unfortunately, the stick. HR is the champion of the people. It is about recognition. It's about supporting their knowledge and their competencies. Sometimes it's about the stick. We don't say that out loud. It's not what that's about. Our job is to get them to a better place if there is concerns. But it is about the people and supporting the people. And right now, I think we're a little bit upside down in this. Any questions on these three recommendations?
So you're recommending just hiring an interim?
Yes.
Instead of hiring?
Yeah, so typically, if you were to hire a permanent person to come in here, they don't necessarily know what's here. And in a situation where you guys have so many challenges with your HR department, an interim can kind of come in and do the hard, heavy lifting that people aren't going to like. You guys have to redo your HR program. But when they leave, they're setting up the permanent person that you ultimately hire for success, because all that hard work and the consternation leaves with them, and then you have this HR policies in effect. Part of what we're talking about with your HR that will need to be done is everybody has to be retrained in their HR policies in the handbook. And then from that point, you set your onboarding policies. And then at that point, you draw a line in the sand, right? Say July 1st, we're going to start following our policies. And then it's up to Randy and the leadership team and the board to hold everybody accountable to following those policies. Hey, mistakes happen, that's okay. If it consistently happens or you're not following, that's when you start to have to go down the other direction. We don't want to do that. But you can't hold people accountable if people don't know what they're supposed to be accountable for, right? Your job descriptions are poorly written. Your understanding of what individuals' jobs requirements are, their 6 to 24-month expectations aren't clear. And so that causes frustration. If I don't know what you're doing and you're getting upset with me because I don't know what I'm doing, that's not fair. It's not fair to them. It's not fair to the organization as a whole. So an interim will come in and set that place in the right direction, get you going down the right. And sometimes they like to stay on permanent. If that works and you guys love them, that's great. If it doesn't, that's fine. But
So
ultimately,
this includes policy looking at?
yes, absolutely.
Head-to-toe assessment of your HR program.
Yeah, well, we certainly can. But to give you an example, we went through, I just did a cursory look at your HR policies. There were over 30 HR policies that had not been reviewed by the department within a year, right, that were past due. You have 1,200 policies, HR owned 30, owned 70, and 30 of them were not done. If I were to extrapolate that out, I would venture to say there were probably a couple hundred throughout the organization that need to be done. But you would go through and you get everybody up to speed. It doesn't happen overnight. It takes time to get there, but you need somebody who can come in and champion that for you.
I think to really look at what you were asking, it will take at least bare minimum 90 days to recruit into the rural environment, to get the right individual here. And we're saying, don't wait.
Can you guys provide that?
Yes, ma'am, we can. I mean, we will do that. But that goes to another challenge you have in HR. Right now, if I were to ask your HR team how many positions they have open, you have a lot. But you have one person in HR right now. So to have your own internal team recruit the right person, looking for the right culture, understanding the balance, unfortunately, you just don't have the staff to do that right now. You have one HR generalist who is being a rock star. I mean, she's got the world on her shoulders. If you guys have ever seen the Atlas, she's sitting there with everything.
She's right there. That is awesome.
So, but it's all those have to be redone. We have to relook at your recruitment processes. We have to relook at your onboarding process, which leads to retention, which leads to happy employees that stay long term. All those pieces have to come along, and that's why it typically takes time. to do that. So whether you choose us or you go through the Wyoming Hospital Association or another, you can find other organizations, but we provide the services that we offer.
I think a lot of what you heard from the staff is that fair, equitable, and consistent. There's inconsistent application of policies, and that leads to the optics and favoritism. I promise you, the majority of the staff here have read the policies, they understand it, but they're not being held to the same standard across the board. So that's why you need to level set, so everybody has that opportunity to come in and sit and say, yes, I've read, yes, I understand, here's some questions I have. I don't agree with this policy, I don't agree with my job description, whatever the term is. We need to level set everything, and then a lag time and say, this is the date certain going forward, that everything that we signed off on, we're going to do, and there's no gotchas. That's not what we want. That's not a good culture.
So how many policies did you say that?
You have over 1,200.
156.
So here's just to give you an example. Imagine if you're a new CEO and you're coming in and you read a policy and you're like, all right, let's follow the policy. Piper, do this. HR, do this. And then all of a sudden everybody's like, whoa, whoa, whoa. Who's this guy coming in here making us do this stuff? And it's like, I'm just following your policies. You know, those are the challenges that any leader that comes in here, any leader will have until this is handled in that way, until it's addressed.
Yeah, you have a question?
Sorry.
Oh, no, you're fine. I'll bring it home.
They'll come back. That's good. So when we think about the timing of some of this, it will take a minimum of 90 days to find the right individual, bring someone here, do the assessment. There's also something that comes with this, an introduction to a culture called Just Culture. Anybody heard of Just Culture? So right
The
now,
service excellence.
similar, very much so.
We just paid $283,000 for that one a few years back.
It's pretty.
Yeah,
No,
isn't it pretty?
it's pretty.
Used it for 3 years.
It's a lot of good content in there.
Yeah.
We think about Just Culture as the opposite of the culture we have today. So when there's a problem, we go to who made a mistake. Instead of quality assurance, that right culture is, let's look at the process, let's see what went wrong, let's understand what steps we missed, educate our team, and repair it and be a stronger team tomorrow. So bringing in somebody who truly understands that type of culture, what good looks like, can set the foundation as you're searching for your next leader.
Well, I know finding chief human resource people is pretty hard. We've already been through that. I mean,
I will tell you, it is and it isn't. When you have an expert who looks at recruiting and goes, I know how to sell a community, I know how to sell a town, I want to understand transparency, it's not as difficult as it sounds. It takes time to get embedded, make sure they're the right people. But in a perfect setting, an organization like ours comes in and we bring you 3 to 5 candidates and say, hey, here's the 3 to 5, they're fully vetted, we know they can all do the job. Which one do you perfectly match your needs or wants?
so we just don't take whatever.
You don't take whatever.
Don't
We're not
settle.
Yeah, we're not. You're not putting a body in the seat, right?
Okay.
The reality is you're finding someone who matches your culture. For instance, you go into some organizations and they may need a CFO who's a turnaround person,
Yeah.
right? And that works for a couple of years, and then they're going to leave, and then you need a CFO who's a stabilizer. Then they leave, and then you need a CFO who's a builder, a visionary. You know, I want to bring up one point that you mentioned, and it's a very important point that you mentioned. 3 years ago, you guys made a huge investment in the community, in the organization here. This is what happens in healthcare, and I'm talking 99% of healthcare. They will train, they will implement, and then they don't sustain, right? So part of the sustainment piece that needs to occur is the auditability of your program. Having an organization, a DNV, a JACO, and us, a Baldridge, somebody coming in every year to say, are you doing it? Are you following your own policies? What isn't working? What is working? If you do that consistently, that's how we get there. That's how we become a high reliable organization where we consistently perform at the highest levels. That's Just Culture, it's team steps, it's all these programs in place but it requires the leadership and the board. So when the board changes over, it's not like, oh, no, we're going left now. No, hey, if we're going down this path and our mission as the board is to provide great quality care, okay, let's stick on the journey. Now, you make rudder changes. Sorry, Navy guy, 1 or 2 degrees left or right. I'm sorry. Thomas was in the Marines. He was the men's department of the Navy. So what I'll tell you, though, is that's what it's going to take. And I bring that point up because a lot of the culture of an organization is, and your staff is going to say, we just did this 2 years ago. What's going to change now? I don't have to outweight. I don't have to wait forever. I just have to outweight this group or this board or this leader. That's not what we're trying. We're talking about holistic cultural shift that takes time. It takes time, but I will tell you, when the organizations do it, they're the best performers. They have the lowest readmission rates, the lowest infection rates, the highest quality scores. Their revenues go up, employee satisfaction goes up, and those are all positives. So, Charles.
And so this is going to be a journey as we go into it. So high level, let's get a little granular. Next slide. Coach. Well, sport, I know. Stop. Coach. What's the purpose of a coach?
To support, assist, and strengthen both. Yeah, you're just building a culture.
That's right,
You have to
troubleshooting.
build
Right?
troubleshooting. Build a culture first. What you want them to buy into, and then how do you support them in getting to where you want them to go?
The first step in some of our conversations we had with your team was acknowledge there's a problem.
Yeah.
We need a coach. And so we have a problem in our clinics. True? Problem within the providers, with the staff and the providers. You can mix it any way you want. We need a coach to get in there and work with the team on the interpersonal relationships, have the tough conversations. I didn't say that piece with the chief human resource officer. That feels disciplinary-ish, right? But with a coach, bring in a coach that really does specialize in team development to get people to start working hand in hand with each other for the patient. Now, the care is good. That's not what we're talking about. We're talking about becoming a team. And right now, what we've been doing and what we're doing is not working, which is the definition of insanity. Let's just keep doing it. It isn't going to work. So a recommendation to bring in a coach, a mentor to come in and to work with the team, because it isn't going to be fixed overnight. And the answer is not let people go. It's to work with people to get them into a better place.
And would the coach come from outside the organization?
Yes. Oh, communication, one of the biggest breakdowns. And the lack of communication, the devil plays on your shoulder, doesn't it? It tells you all sorts of things that may or may not be true. So do we have a communication strategy? Randy started one. If you see a cadence that is started, been in the newspaper a couple times already, a message internally is going out. But communication is a strategy. It is saying the right things to the right audiences and moving the ship forward. So yes, develop a communication strategy together with the board and all of leadership to be able to clear away the gray and tell the reality, the facts. In the absence of facts, I make up my own. Is that going on here?
Oh, yeah.
So, communication strategy. Leadership presence. Being present. How well do you know your organization? Where we come from, we recommend, and I know many boards don't like it, but it's a monthly interaction with the CEO, with rounding in there, talking the team up, and saying great things about the team because you guys are ambassadors. It's the Randys walking every day through the hallways. It's a purposeful rounding by all the leaders as well with the care delivery, recognizing them and asking them, do you need anything? What resources you need to deliver the great care that's out there? That's a purposeful strategy that needs to be developed. Best practice says this: for every leader, they round 100% on all of their employees. We're talking about their direct employees every month. It isn't hi in the hallway. It's sit in the office. How are things going? How was the soccer game last night? Getting to know the people on a positive professional side. Don't know if that's, I'm saying it rhetorically. I know it's not going on in the purposeful way, but it's definitely something that needs to be going on in the more structured way. Recognition isn't always good job. He's like, ouch. It's more of a purposeful recognition, genuine on how well the team is doing. Do we have a full recognition strategy? You can feel it in the hallways. You know when people feel valued. They look in your eyes and say, hi, good morning, how are you? Can't say I felt that here. Good people, but the presence of feeling valued is one of the #1 people goals that you all need to create, a meaningful recognition strategy. Does that make sense?
I thought we were doing that. I mean, that's.
Well, I never want to take away from what is going on.
Well, we do the, I call them atta-girls, but, or atta-boys. Well, we do the, I call them atta-girls, but, or atta-boys, the little notes on the.
The above and beyond.
Yeah, the above and beyond. We do, it seems like we do a lot of things.
The monthly board.
Yeah, the board recognition.
That's just a snapshot. We see it on Facebook, we see it in the organizations, we see picnics, we see potlucks, we see, you just feel the fun in an organization. It's good to be here. I would ask, after we spent the last about 2 weeks and the last 2 days here, are people feeling safe and enjoying their job? I'd probably argue not.
No.
Because of the feeling of retaliation and not being safe. And so how do we turn the tides? We have to celebrate the wins.
Could you go into retaliation a little bit more? Like retaliation by the board?
I'm sorry, please say it.
Could you go into retaliation?
The themes of retaliation.
Thank you. Happy to do so. I want to say fair, equitable, and consistent. So I have brought a complaint, and suddenly what I was doing before, I'm no longer doing. And I feel that I am being punished for bringing up a complaint. And the reality is, it may have been something completely different, but the optics are, you tell me to bring a complaint when something goes on. I bring a complaint and now I'm doing something different.
Okay, the complaint went to the boss, the complaint went to who? I mean.
And therein goes back to the lack of trust of leadership. They have said.
They're like the direct supervisor.
They have said, we do not trust that our leaders will treat us fairly, equitably, and consistently. When Thomas Steiner goes behind a closed door for a crucial conversation with Steve, and Steve comes out, we don't need to know what happened in that closed door conversation. But what we do need to know is that Thomas treats Steve fairly, equitably, and consistently. And the staff is saying, I don't believe that is happening. I do not believe that is happening. Now, I need to jump in and visit with my colleagues at the clinic and say, if you had engaged us to do this assessment in the hospital, do you think the results would have been different? If you'd engaged us to do this in the manner, do you think the results would have been different? I want you to hear from me that from the clinic, you are not picking on us. And I need for the clinic to hear from you, no, I'm not picking on you. I promise you, clinic, you were what we signed up for the assessment. You were the tip of this iceberg, and we are listening hard to what has occurred before, and something is different today than 30 years ago, 20 years ago, 10 years ago, 5 years ago. Something is different today, and this board has heard what is going on. So I do want to say to my colleagues at the clinic, they feel like they're under the microscope for bad reasons. Maybe yes, maybe no. What's coming from it is an opportunity to change culture, as y'all have indicated, across the board. So please know the clinic has this sense of we're feeling picked on with red-headed stepchildren, when in fact this governing board, in my mind's eye, is saying we need to take a pulse check. We're starting with the clinic. We understand. We're going to expand upon that. So please hear that. Did that make sense?
Yeah. The one thing I would add in regarding the retaliation, there's the reality and the perception of it.
Yeah.
And so when you a person gets terminated because maybe they were lackluster performance or they had a violation or something, and they get terminated, you can't message it and say, hey, they got terminated because of poor performance, right?
Exactly.
And so people will assume the worst. And to Thomas's point, I think as the culture changes and people learn that, no, it's fair and equitable. If somebody got terminated, there was a specific reason behind it.
This is that bright line in the sand. We all read the policies. We all agree. Leadership agrees that we will be fair, equitable, consistent in our following of these policies, and this is how we're moving forward.
So it's going to take time to change perception.
It's going to be, well, it's difficult in a small community where everybody knows everyone and
Yeah.
related to everyone. And from a hospital's point of view, on the professional and ethical conduct, there may be logical, real reasons why something occurred, but professionally and ethically, we don't say it. And that's just how this works. On the other end, there's no guarantees. And so we have a little bit of that, but there is a perception that there's retaliation within this culture at all levels.
So you're talking this is like a 30-year thing?
No, so typically what I'll tell you is to change culture in an organization this size, on average, is about 3 years, right? Memorial Hermann was a large system, 37,000 employees. It took them 8 years to go through the transition.
Oh, really?
But for small hospitals, it's typically 3 years because there's so much that goes into changing perception. It's training, it's education. You know, if, for instance, you do 12 case reviews a day, and the industry standard is 30, but you do 12, and you're like, hey, I'm crushing it. And then all of a sudden, a new CEO comes in and says, hey, best practice industry standard is 30. I'm sorry, you're not performing. Pick it up or get on out. That's an education moment, right? We have to teach people what the expectation really is, you know. And you look at your organization as a whole. I'll go back to when the clinic came on board and it was purchased by the hospital. Right. Were expectations clearly defined to the clinic from the hospital? Was there a good onboarding process?
Probably not.
Probably not.
And transition.
We are here because of decisions that were made or not made.
Right.
It's a logical progress.
And so we look at all of that, and that's why it takes a while to get there. Because I can sit there and just say, hit the I believe button, or in the military I say, shut up and color. But you know, you can't do that to your employees. They need to know, they need to feel, they need to trust and believe in you. And so that's what you're talking about reestablishing.
Investment, meaningful investment from a leader's point of view at all levels of the organization. Things like Communication 101, or crucial conversations, how to have a tough conversation up or down or to your peers that is safe. Everybody hasn't been in a safe condition in the workplace. It's very hard on not only myself, but my family as well. So how do we do it respectfully? Budgeting. Have we given the tools for our leaders to learn how to budget, to manage their monthly reports, whether it's finance or quality? Leadership investment is key, and it doesn't stop with, hey, let's put a few sessions on the book this year. It's forever. We're always investing in our leader to be a stronger team to face the challenges of today and tomorrow. Mission, vision, values. Are we committed to our mission? We feel it. We see it in the hallways. We talk each other up. You feel it as a patient because that nurse or provider came in and you hear that I'm a part of the team and we're in this journey. Are we living our mission at this facility? And so, yes, we've done some exercises of the past, and I would say we probably strayed a little a ways from our mission. So either strengthen it, recommit, or train back to why we're here, that why itself. I'm a big, firm believer in data. Steve and Thomas were talking about. You cannot improve anything unless you measure it. If there is no data, then I'm shooting in the dark. And more times I'm wrong. So getting data and benchmarking that data against like-sized hospitals will guide us. Are we doing better or worse than the state of Wyoming in critical access hospitals of communities our size? And if we are doing better, then let's do even better. It's that drive.
Well, as treasurer, I always say no mission, no margin, no mission. So I'm a little compromised.
It is, so you understand those components, but yeah. What if I were to suspect, the word is suspect, that maybe there are some disgruntled people in our community, I'm just going to assume that for a minute, and they choose to go somewhere else. So they're not getting care locally, yeah. And the dollar bill is going somewhere else. Mm-hmm. So earning the trust of our community, keeping care local, doing what is right, helps with your margin. Okay. And then hearing the voice of your team. So this is an organized engagement. Many organizations do this as well, provide this annual provider and staff engagement survey. It is confidential. It is third party that comes in. Best practices says every year, and we get stronger every year. They benchmark us off of the nation in like-sized facilities. They have best practice tools. We don't have to reinvent the wheel on how to become a better team. Usually happens in the summertime, both for the providers and the staff. It comes to be transparent, starting at this table, so you get to see the raw scores. And then to the leadership team, let's put action plans. So when we do it again the following year, our expectation as a board is we're doing a better job. We have a stronger culture. This is a really good way to understand your culture.
To dive in on that, just to set expectations, your first one is always awful.
Yes.
Okay? Because the first one is the first time that everybody wants to come out and talk about the challenges and the issues and why haven't we done this before. But as you do these, they get better. It's more consistent. In the military, we do these. Every time a commanding officer or a CEO leaves an organization, they do one, where's the culture at when he leaves? And then about 6 months after the new one gets here, what's the culture when he gets here? Are we going up? Are we going down? Do we need to make changes? That way you don't get 2, 3, 5, 10 years down the road and be like, what happened to the culture? What happened to our organization? And that's the value that these can consistently bring. It goes back to that same yearly audit, those type of things. And when you audit an organization, it's not everything. It's a couple things. Where have we had issues in the past? Where are we seeing triggers that we need to address? Those are the things that will consistently, steadily show you that progress that you're looking for over time.
It seems like we do a lot of staff engagement things, don't we? In the last few years. I've only been on this board 5 years, so.
We used to do them every 2 years.
Yeah.
But then we haven't for the last 2 or 3.
It was probably, the last one was probably 2 years ago.
Yeah.
But we used to do them every 2 years.
COVID was a big equalizer for many, right?
It tripped us all up.
Yeah, so, yeah.
Before I get into this right here, tell a little bit of a story. I got some boots on, country boy, picked these things up in Texas. Bought a house in Texas a number of years ago, and we were walking around the house, and the surveyor was mumbling, and I'm like, what is he saying? And I'm just trying to figure out. He kept saying pride of ownership. And I'm like, what do you mean pride of? This guy took care of his home. There was a pride in ownership. Can we tell our pride of ownership through the communication channels? We sat down and watched Aubrey work with your team, and I popped my head in for those who were in yesterday's meeting, and Aubrey came, and I'm going to narrate what was not said. Who is this person? What is she talking about? And then she started to do her magic, and then we watched one person after another wanting to tell her the story of your place. There is a lot of pride and ownership. And then we posted Nacho. Good video to post. How many people saw that?
Thousands.
Thousands of people saw it. And it's like thousands meaning more than in this community. So in the algorithm, and Aubrey can speak so much better than I can about that, the more that people like and share, the more people see it. So tell your story in an organized way, the pride that you have in this place and the amazing care that you deliver. Because if you don't tell it, who will? No one, or tell the wrong story. Pride of ownership. This is good. I met Randy about 2 weeks ago, and one of the first things we did is we jumped on the website, and I'm like, nice picture. Professional pictures mean everything. It gives us confidence that the organization knows what they're doing. So let's do some baby steps. Aubrey's going to be working with your team for the next couple months and getting the programs off the ground. And let's set up some professional photos for your team, the board and the leadership team and the providers, and start posting them on the site and walking in that direction. In the privacy of my own home, I can research anything. I can go, what is this doctor about? How is the care? I can go to something called hospitalcompare.gov, and I can look at all of your quality data against other people's quality data. I'm my own investigator in there. So at the end of the day, we got to make sure we're looking the very best because people have choices. And we want them to choose us. I have one more coming here. Yep, I saved the best for last. Board recommendations. We talked a little bit about it. Nothing is overnight. And we said something like, who we are today as a board is, it sounds like, probably not who we're going to be tomorrow. There looks like there's going to be some changes here. And so one, investment is not one and done. It's doing a survey, seeing comfortably what you feel you need help on, putting together a syllabus, and constantly training the board. Now, I don't know to what extent all of your meetings are. I've seen it done in a bunch of different ways. You have some subcommittees. I've seen it where you have your regular board meeting and then a separate meeting that's really about education. And education can come in these forms, like financial management or quality programs. It could come in with the staff teaching you about the latest piece of equipment, or the diabetic educator talking to you a little bit about diabetes and healthy eating. Educating the board on healthcare is extremely important because that's what we are. So, board education. We have some new board members. I'm making assumptions. So a strong board orientation program. First impressions are everything. So if we don't have first impressions, then it's very clunky to get engaged in the right way. I think I duplicated this. I was just re-emphasizing.
I think the third one that we didn't have up there was the board retreat. Annual board retreats are essential. It gives you an opportunity to get together as a board to work on what do you want to see happen in the coming year, where are you currently at in your strategic plan, what changes do you want to make, and then about every 2 to 3 years is when you do a full strategic plan and vision, when you start looking at the 5 to 10 year out aspect of it. And so,
What about board evaluations, what you're giving them there? Self-evals?
Yep. I think there's a couple of things that probably will come out of the operational assessment. And I'm looking a little bit at Randy. So self-evaluation as a board, and where are we and what do we need to invest in? CEO evaluations, we support the American Hospital Association's CEO evaluation tool. And so making sure that one, it's done correctly and he's getting the right feedback, and then generally a 360 eval that comes with it. Many of the topics that we're scratching on really will come to light when we're ticking and tacking what we're seeing to data. And this one was really designed for the people side, when the next version should really be about what's under the covers, what's in the closets, what's under the rugs, and figure out where our gaps are so we can start moving forward. All right, that was a lot. The good news, it wasn't 4 hours. 3 hours, maybe 2.
1 hour and 37 minutes.
Thoughts overall before we talk about next steps? Yes, ma'am.
I would like to see either as a printout or as I would like to see what Thomas had. You know, right, one of the first slides you had was about what you thought of what you discovered as far as the board.
Mm-hmm.
I think that would be a nice thing to actually have.
Okay.
You can get that for you.
Yes.
Yep.
Yes, so
And I can
that.
get to you.
If I had an ask of you, it would be a couple of things. One, please let your doctors and your mid-level providers, your nurses, and the front office staff at the clinic know that you heard them and that you appreciate their honesty. And they had no reason to trust me. They had no reason to trust, y'all assume that, but yet they did. I think that speaks to their integrity. So if you have the opportunity, I encourage you, as one of my professors said, if I stomp my foot, it's going to be a test question. I encourage you to please step across the street and thank them for the work that they did over the past 2 days, because it was not easy for them to do. And it took a tremendous amount of courage for them to do so.
Dottie, thoughts?
You're on mute.
I know.
Okay.
My thoughts are that a yes vote for this program is a yes vote for the hospital and the community.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
A yes vote for this program is a yes vote for the hospital and the community. I just think that the things that have been discovered are things that need to be addressed, and I don't think we have anyone in the facility besides Randy that can address these things, and he would need help as well. This is not all his expertise. So I think that this culture needs the expertise of you folks.
I agree.
I don't know how much it's going to cost.
So the next step, kind of comes in.
I'm the
here.
money guy. I don't know what to tell you.
Like with anything, a detailed scope of work would need to be put together. We have much of that done. We wanted to get input before we put it all together. we generally, because it's contractual, take it over to the CEO, and the CEO, in whatever manner that you choose, can have a session. I also know that next steps is we presented a lot of information. Some of us, including myself, are mullers and like to ponder a little bit and see what we have. So our team would like to offer over the next week or so, if you have any follow-up questions, feel free to reach out. We're happy to spend some time with you on any additional questions you have. In the meantime, we can scope out that work and begin working with Randy through him to you all.
You have my cell phone number. I told you when we talk, please call me. I am vested in this organization doing beautiful. The potential is there. They're smart people. You're smart. The care is good. The care is safe. What are we going to do to help support those who are at the bedside? You have myself, please call me.
I'll hit a couple points real quick that may be on your mind, so I'll address them. Cost. There's a cost with everything, whether it's us or any other organization. What we have done and what we've been able to prove through the organizations we work with is we typically pay back a 3 to 6 time ROI. So for every dollar spent on us, we bring back between 3 to 6 times whatever that dollar spent is, whether it's through efficiencies, increased services, revenues, efficiencies of varying degrees. So that's one thing we can tell the board with confidence, with a guarantee that we provide that for you. The other thing I would throw back to you is oftentimes the boards are like, well, that's why we have a CEO. Well, that's true. If everything in your organization is functioning well, a CEO would be great if he was just maybe looking at just compliance, or maybe just HR, or just a clinic. But when you're doing this in every direction, you need an organization, an outside organization that can come in and stand shoulder to shoulder. Our organization focuses on teaching your team how to do this for longevity. We teach you how to fish. We're not going to do it for you. So, and
we'll be right next to you doing it together, and then as you stand up, we stand back.
Yeah, the objective is not to have an organization like us here forever. It's to be here long enough to you guys can sustain it, and then whether it's us or another team that comes in about every year to do the audit, that's where you get the sustainability. That's where you don't spend the money and then be like, we just did this 3 years ago. You know, it's, hey, we're sustaining it. And I will tell you, people will say, well, we need to save more money, we need more cash flow. There's a certain level, there's a matrix that you follow. There's a certain amount that you need to have on hand. If you go above that, you're not investing in your organization, your people, your facilities, and you'll have a lot of cash, but in 2 or 3 years, you'll be back to doing this. Well, now we have to spend the money we saved. So
it isn't always about.
I know.
It's that Friends commercial. You can pay me now or pay me later. You know?
Yeah.
The way to get paid.
But what I will tell you is what our organization, our team will give you is we give out our personal cell phones. Call us 2 a.m., 2 p.m. It doesn't matter. Our goal is for the organization, for the staff, for the team, we're here to support you in whatever your goals and objectives are. All right? We work through the CEO and the board to make sure that the mission is being delivered for whatever your mission is.
How long would that process be with when we're working with you guys?
Well, in historics, we typically do the assessment and that'll determine it. We've had organizations that have signed 24-month contracts with us and others that have done 12-month contracts with us for the implementation piece. Okay. So it really determines where you want to go. We had one contract that was a 6-month contract, and then they just extended for another 12 months. So, but we're very transparent in telling you that it, on average, takes about 3 years. Doesn't mean you need to pay us for 3 years. Until you get to the point where you guys become self-sustaining, you're going to need somebody to hold your hand. Some will get it right away, very quick. Others may need a little bit more rules because, for instance, compliance is a very, very complex aspect. And if you get it wrong, the cost of getting it wrong is astronomical. You know, so I think with your organization, a lot of it is just going to fall on the right now the people pillar. It's falling on HR to get those processes in line. And once that's done, in 6 to 12 months, you'll have a much clearer vision of where you're at and where you need to go.
I'll add, the operational assessment usually is the foundation of your strategic plan. And so when we think about strategic plans, we think about activities that are timely. And so by definition, the board guides the organization. They spend a little bit of time understanding the health of the organization, but they say we want to go this way. So this strategic plan generally once a quarter comes to this table, and you're like, we said, we agreed that this is what it's going to look like. By when, by who, are we on track? And generally that first year is a bit clunky, but that operational assessment generally is a 2 to 3 year kind of foundation. We put it here, you get used to it, and you're going to say, hey, I would really like this type of service. It goes off to Randy, goes through a pro forma, see if it makes sense. It comes back to the table, you put it in your strat plan, and we keep moving forward. That's usually year 1. Year 2 is what we call SMART goals. Are you familiar with SMART goals? Goals that are measurable, they're specific, they're attainable, they're realistic, and they're timely. And so you put them and say, listen, we want to have a 5% margin by the end of the year. You see how I focused on the dollar bill? It's right there, it's good stuff. Or satisfaction, we want to have the 85th percentile by this time. These are CEO and board metrics that guide the organization on where you want to take it. And right now, much of that is not here. And so it is about getting that machine built to get the momentum so you can be a high-performing organization.
Can I ask how many organizations you guys are working with simultaneously, or are there multiple ones that you guys are working with?
Yes.
Okay.
So we have 4 organizations right now that we work with.
Okay.
So usually it's about 2 organizations per team member.
Okay.
And so, you'll have a lead for your all's lead. It's Thomas is your lead in this organization. And then our team, whether it's Charles, myself, we have another individual, Chris. We breathe in and out of the organizations based on our skill set. My skill set is HRs and facilities.
Okay.
Charles is kind of a chameleon. He can do everything. And then Chris, retired Force Master Chief, he's all on leadership.
Okay.
Leadership 99.9% of the time.
So you just rotate through.
So yeah, we rotate through, but the value of that also is that as we come in, the different eyes that we see, did you notice? Oh yeah, we did. No, I didn't notice that. And it allows us to continue.
In this case, Thomas would be the consistent.
Okay.
My background is more clinical, so I generally breathe a little bit more toward the topics of quality and compliance.
Okay.
And so if there's an education out there that is more accustomed to my skill set versus say Thomas's, he will be the consistent that we breathe in. We have 4 pillars in our organization. One is leadership development at all levels of the organization. Healthcare advisory. Our advisors are usually C-suite, CEOs, CFOs, CNOs, those type of folks who really are experts within their field. Executive recruitment, so recruitment across the spectrum, from assisting with board, getting the right people, the job advertisement, hey, listen, we need these type of board members, a call to action, to CEOs, to chief nursing officers and directors, and then digital marketing. Aubrey leads that digital marketing. Currently, I have, he's coming on board right now, and that's the reason why some of us, there's 3 of us here. I have 4 hospitals myself. This is going to be the 5th hospital, but we have our fingers in a dozen other hospitals in different services as we work with the region or with the nation across the land. Good question.
So how long has H&H been doing this?
So Charles and I started the company back in November. Charles and I had worked for about 2 years prior to that in another organization. And then, my focus has been in recruitment and healthcare for 7 years. Charles is greater than 30 years. Thomas has been here since Christ was a corporal. So, we have greater than 50 years of experience doing this specific work. My focus is truly on the people side with the recruitment, finding the right leaders, and then I work closely with boards and leadership teams in HR.
If I can interject, one of the things that has attracted me to this, I've spent, like Randy, a clear 30-year career with places recruiting me to say, I've got a vacancy, I need a problem, will you please solve it? I'm filling vacancies to do a role. And this is, I'm not filling a vacancy. I'm making whoever's in that role successful. I'm trying to work myself out of that need. And for me, that's very intrinsically rewarding to be able to do what I've done throughout my career, but not to obtain that position. My goal is to help someone else be wildly successful in their position.
To add on kind of what these gentlemen are saying, Steve's previous firm that he worked for a number of years placed me as a CEO at my last organization. And when we started talking about the next steps, I started this side of the organization about solutions while we partnered with his company, and we basically merged it together this past fall. We've been doing this together for the last a few years, and we've known each other for the last 5 or 6 years, and it's very synergetic, very complementary of the skill sets that we have. Thomas is somebody we placed up in Alaska a couple years ago, and then when it was time to come home, Alabama, we're like, no, come over to us. And so he's joined our team and been with us. He left Alaska in December?
Correct.
December. And then he joined our team shortly thereafter. So we try to find these type of folks.
Beyond that, we have a group of strategic partners that we've worked with across organizations. We have a physicians group that does ED and hospitalist services. We have an international nursing and international physician company we work with. We have homes. A lot of our rural communities are needing homes because they don't have places for providers or staff. So we have a modular home designer that will come in and work with them. We have an interior healthcare designer that can come in and help redesign spaces in hospitals. But we have found that to be successful in healthcare, we're a small firm by ourselves, but as we broaden our strategic partnership, we can help with the many solutions that most of the firms need, because it's hard to find trusting partners within an organization. And if you're a small firm in Wyoming, sometimes you may not have an interior healthcare designer here in the community, and so then it's like, who do we trust? And so that's what we try to provide for our services. But to kind of sum up everything, the board, I think, got the understanding today that everybody needs to kind of get on board, and it's not about individuals, it's about the organization, and it's about, most importantly, the patient. I think with your staff, there will be some transition to understand that it's not about you as an individual, it's about your ability to provide for the staff or for the patient and be part of the organization. And that's an awesome aspect to understand when everybody's all agreeing that we all want to go this way. We want to provide the best patient quality care. And I can tell you, in the 7 years I've done this, in the 300 plus organizations I've been in, when I ask this question, I have never had a person say, I don't care about patients, right? And that it's at least a good starting point, right? And so if you have that, that's what we build as the why, and get everybody to see that. Now, whatever direction you come from, neither here nor there, as long as we're all focused on great quality patient care, and it's about the organization, not about self. When we talk about why, I bring this up all the time, a paycheck is not a why. A paycheck is a reason, right? The why has to be something bigger, and that's what we want to get everybody focused on.
I was going to ask one more time, not sorry to keep everybody, but your sustainability rates with the organizations that you've worked with, how would you say how successful that's been? And if they don't pan out after you guys go back and look, what would you say is a common denominator in those organizations where it doesn't become fruitful and it doesn't pan out the way that you guys wanted to see it, or they wanted to see it?
So
if that makes sense.
Yes. So currently, the organizations we've been with over the last 2 years, we've had 100% success rate.
Okay.
So where I will tell you the stumbling blocks are is we can't be the ones to do the work.
Exactly.
You have to get the individuals in the organization to buy in to do the work and actually execute on it. Now, I will tell you, some have been slower to react, some have been faster. We have to keep up. It's like, hey, we called them, and they're already 2 days. It's been 2 days. And then others, it'll be like they won't touch it again until we get there. And so that really depends the amount of time, and that really can lead. We have one organization that is probably on a 12 to 18 month cultural shift. I mean, they're really engaged and fast, and everybody bought into it. We have another one that's a little slower. They have had some unique challenges.
You got a couple that are overachievers, so much like what Aubrey does, they're interviewing board members and staff, and they're on the screen all the time, and and it's wonderful, and the camera is wobbly, and we're like, good job, steady the camera. And so from our past, I've helped bring organizations to 5-star organizations and rebranded them. My background is small and large organizations. Military guy, Navy nurse, John Hopkins graduate of a couple master's degrees. Patient is my mission, and you'll never hear anything different. I understand the dollar bill quite well, no worries on that part, but it is the purpose of why we're here. And for those who want to join that movement, those are the folks that we're most enjoyed working with. There is others that we have chosen not to work with. That is a choice as well. If they're not ready to make that transition, not interested in having you spend the money if you guys weren't ready for it.
I am like you. I like to brief and I like to teach everybody in the healthcare as a business associate, from the food service to the janitorial to the nurse to the CEO. You're a business associate. There's no mission without the margin, right? And this is an interesting thing. When we go in and we QA or ask questions to people, and you ask a lot of the staff, what do you think the profitability of your hospital is? The most common answer, 20%. Wouldn't you love to have that? Oh man, absolutely, let's do that. But I will tell you, it's a lot of times where it's not. It's 1%, it's 2%, it's minus 2%. And so it's important to teach fiscal understanding to your staff. So when they're demanding a higher salary and you're like, I can only do $1 more an hour. Why? That's not fair. Well, this is why. What does it mean to be an exempt employee and a non-exempt employee? What guides that? And a lot of it is just, it's lack of knowledge, But I think that what I get from your organization, and we've only been here 2 days, is that people want to see change. They want to be a part of change. The rubber will meet the road when we come in and say, okay, guys, let's do it. And they're like, whoa, whoa, whoa. You mean today? And that's typically, that's exactly what it typically is. But I'll tell you, the first couple months, once you get into it and you start getting the staff and they start to seeing it and they're like, oh, these guys aren't going away. Oh, Randy's not going away. Oh, we're starting to see progress. That's the value of it. You guys have a great board, the 7 members, even those who are choosing not to run again. You're going to have 2 other great board members. And let me tell you, for most of them, it'll be a shock. Oh, I got to do all this stuff? And I got to be on this extra committee? And I'm liable? Yes, it's all of those things. But you know what? You are affecting care for your community, and you're making a difference. And it's a call. It's a call. It's a passion. You didn't come on this board. I don't think anybody came on the board to get rich. I'm extremely sorry if that was your intent. That's not it. You came on the board because you wanted to make a difference.
We do get food
part-time jobs.
Yeah, it's unpaid part-time job with free cheese and crackers.
Yeah, exactly.
But it is. You guys are doing this for a reason. It's a passion, and you want to do. There's nobody on this board. There's nobody in your hospital that doesn't want your community better. So, we really appreciate the opportunity to present to you and having the opportunity to just come and meet your team, yourselves, and your staff. It really was an outstanding several days.
I appreciate it.
Thank you.
You got a great burger place right there. Great razors. Great razors.
Oh, I know. Isn't it
Good burger.
Really good burger. Really good burger.
Drop in the bucket. You want the best burger, drop in the bucket.
Okay. Does anybody want to make a motion to, or do you?
Well, I just want to say, I think we owe it to our community, to the patients, to move forward with something like this. But we owe it to our staff to invest in our staff that we have. Because if we don't invest in our staff to mentor them and get them where they want to be, we're not going to have any staff. You can only recruit so many people to Weston County and to, Weston County Health Services. They're just not going to come. And I think the more we invest in our staff, the better we're going to be. Is it going to cost? It is going to cost. But the return on investment is going to be way higher than what we're going to spend. So,
My last word is, I can't see, we cannot afford not to.
I agree.
Do we need to vote?
Well, I think we need some data first.
May I make a recommendation? If the board would agree to have us put together a scope of work and a cost and bring you guys a contract, and then we could get together and present that to you in the coming week or so, and then go from there.
That was gonna be, that's when I went, and you start speaking.
Yeah.
You spoke through me.
I did.
That sounds reasonable.
To me, it seems like something we need to talk about at our next board meeting, which is not 2 weeks.
I'm sorry, I can't hear Ann.
Oh, sorry. I said,
That's okay.
I think it seems like it's a decision that needs made at our next board meeting.
Now, when you say that, are you saying we don't have them move forward with the proposal or anything?
Oh, no, that wasn't
That's not what you were saying. Okay.
No, I'm just saying that it seems like that's when the motions and stuff, that's when we need to when we need to make a final decision.
Board wants to get together.
Do you need a motion to go ahead and go through?
No,
Oh, okay.
no,
Okay.
we'll just, that's nothing that it doesn't, not requiring a spend or anything, just say do it, and I'll say do it.
Okay.
We'll execute.
Ann, are you saying that you're okay if they go ahead and put a proposal together and bring it to the next board meeting?
Yeah.
Which is approximately 2 weeks?
Yeah, that's what I was
Is that
thinking.
enough time?
Yeah.
That we can delve into it in greater detail once we have the
More
data.
More data. I'm a data freak.
Yeah. Are we all in agreement with that?
Yeah.
Gary? You in agreement with that too? There you go. Then I will make a motion that we leave our special, that's my specialty.
It is.
I'm always the one that starts it.
Second? I'll second it.
You going into executive?
No.
No.
No, just,
Not need to.
okay.
We're going home, Walter.
You forgot the old.
Discussion.